My name is Mandy Rodrigues and I'm a clinical psychologist in private practice. I'm also chairperson of the counselling arm on the SASREC board. So I've worked in the field for nearly 30 years, coinciding with my own journey of IVF and miscarriages. A lot of my work involves counselling individuals and couples on their fertility journey. This also involves assessing donors, recipients and surrogate mothers. I am not limited to infertility, but also focus on more general clinical work like depression, stress, marriage problems, trauma, either with or without infertility. I once thought that entering the field of fertility was a field implying abundance and growth, spreading positive news and baby photos, but I soon realized that the majority of the work I do in infertility is about loss. Even though most couples we see emerge with a healthy baby in their arms, this isn't what I get to see in my role. I love the positive visits later with the photos for our wall, but I also see the desperation, the loss, the negative results, the difficult decisions. When I went through my own infertility, there was so little support, no social media, and infertility was more of a stigma. I'd like to think we have made huge strides in this field over the last decade, and I'm proud to say that South Africa sits right at the top with superb specialists and clinics. You may think this is just a job, but every organization, every agency, many lawyers and specifically counselors all speak of their own journeys. Most of us have run this marathon, and each positive result is something we rejoice in too.
The Fertility Show Africa is actually that platform to show that there is help, there is support. You have people that can assist you to walk this journey. We understand that the fertility journey can be challenging, can be draining emotionally, can be draining financially, and it causes a lot of stress along the way. So our first talk on the program is Stress and Fertility by Mandy and Saskia. I'm just going to read their profiles. Mandy Rodrigues is a renowned clinical psychologist who has worked in the field of infertility for the past 30 years. This includes working with individuals, couples, and groups, helping them to cope with the fertility journey and assisting them with making life-changing decisions. A large part of her practice involves stress management and the need for a multidisciplinary approach to infertility. Mandy has presented and published various books and articles on the subject. Welcome, Mandy.
Thank you, Tony.
And Saskia is the founder of the Infertility Awareness Association of South Africa, which she started in 2013 after a 7-year journey through infertility. And she's the one who's making this possible for us to be here today and every year actually that we gather like this and help each other to walk this journey. Welcome, ladies.
Thank you. Thank you, Tandi.
Take it away.
Welcome, everybody, to day 2 of Fertility Show Africa. Mandy and I are just going to have a very relaxed conversation about dealing with stress and fertility. You guys are welcome to ask Mandy any questions you have. Otherwise, she will be here for a little while afterwards at the MedFem stand if you wanted to talk to her privately. Welcome, Mans. Thanks for coming back for day 2.
Thank you, Saskia.
Okay, let's kick off with what role does the mind-body connection play in fertility?
So that's an interesting one, and I love the way the show is organized. That yesterday we had very scientific and medical talks, and today for all of you we've got very support-driven talks and psychological talks, so it marries the two. We know from the field of what we call psychoneuroimmunology, which means the brain and the body and the hormones all work together. And many of the speakers yesterday said the more stressed we are, the more we do anything in excess, whether it be exercise, eating, under-eating, the more it impacts on the pituitary, which then has an impact on your cycle, on infertility, on cancer. There's a whole range of illnesses that the more stressed we are, the more at risk we are of getting those illnesses.
Yeah. Very true. Does stress play a role in the success rates of assisted reproductive technologies such as IVF?
So this is always an interesting debate because everyone going through ART or IVF is stressed. you can't but help be stressed going through this because it's got financial implications, it's got relationship implications. Physically, you're going through aspirations, you're going through waiting for lab decisions. So yes, there is acute stress. I'm not worried about the acute stress. I'm worried more about the stress that happens separate to IVF, more the chronic stress. So the stress when you go home and you're worrying about deadlines, the stress when you go home and you're worrying about what to cook, that chronic stress that has happened maybe for months leading up to your IVF. That's the stress we're more concerned about. And there was a study we did probably 26 years ago on women who had already had one failed IVF. So there were about 50 women that had one failed IVF. They all had endometriosis. And we looked at their stress levels. And they all presented as what we call the old type A personality. We managed that stress, and the subsequent IVF, we had 67% of people fall pregnant. So the only thing we changed was their chronic stress. They all were exposed to the same IVF, to the same stress caused to the same there was no additional treatments we gave, but if they reduced their chronic stress, their fertility rate doubled in terms of the next IVF, which I think is a lot if we're going through IVF.
Yes, no, that's a huge amount. How do I know, Mans, when stress is bad for me?
Okay, so if we look at, I always bring the example of poverty, war, famine. Have a look then. People do not actually worry about falling pregnant. They're not thinking about it. The pregnancy rates, in fact, go up during war. And I mean, a lot of theorists would say that's because it's an evolutionary thing that men are possibly going to die in war, so women fall pregnant with more boys. But it's actually a very real stress. Anyone who's going through what we call real stress, now how do we define that? Real stress is what we call good stress. Real stress is when you think of someone in your life who's actually pretty chilled. Think of a judge in a court of law, and as you get stressed, you ask yourself, would a judge say this is something I should stress about? Would someone objective say this is something I should stress about? If it's yes, it's good stress. Then we're secreting adrenaline. So if I say to you, there's a roadblock coming here, which we know that there's some race going on, Vitality race. Should I be stressed that I'm going to be late for the conference opening? No. It's not like you're an anaesthetist running through and you've got to go into theatre at 10 o'clock. It's something that a judge would say it doesn't really matter. This is going to be filmed. This is going to be aired. You can come in and speak to everyone afterwards. So that's how we define it, as to whether a relaxed person would stress or not. That's good stress then.
Thank you. What about the immediate stress of IVF? So how do we manage that when we're approaching a cycle, that immediate kind of exacerbated stress that we're under rather than just our normal chronic stress day to day?
Okay. So for those of you who listened to my talk yesterday, I said one way to manage stress, and this is in your life in general and IVF, is predictability. If that example of the race, if you predicted that 5-kilometer race was happening, what would you do? But you would plan to maybe leave a bit earlier, or you would check an alternate route. So big thing with IVF, plan and predict. So we know and you can use it for an IUI, you can use it for any month to month you're going through. Look at when your tough days are, kind of break that cycle in IVF into days you're having stimulation, and then you get to a scan. And then you have a few more days of stimulation, you get to your second scan. And then you have 2 more days before they aspirate. So if you break your IVF into manageable parts, you can predict and you can plan. It's very stressful trying to think what is that result going to be at the very end. But if you can kind of, like I used yesterday running a marathon, and you know you've got to get to a certain point, and then a certain point, it makes it far easier to manage.
Break it down, yeah, for sure. How can healthcare providers and fertility specialists incorporate stress assessment and management into their treatment plans?
So during COVID was very interesting, Saskia, because a lot of the societies that govern clinics around the world, in fact, because there was a bit of a breather, started looking at the impact of psychological health on infertility. So, especially in South Africa, through the board, FAST has always been a very good spokesperson for the patient, and having talks in terms of how to manage your IVF, different speakers on psychological topics. But it is now important that every fertility clinic give you, the patient, the option to go and speak to a counsellor. And again, we're hoping that all the clinics, when you go there for that first point of contact, whether it be with your fertility nurse or your doctor, you're given some sort of possibly screening that says, yes, you maybe are stressed, and this is a resource you could use, and just give you that opportunity. And I think yesterday when Discovery spoke, they were going to have a look at that in terms of a prescribed minimum benefit almost, that when you're entering IVF, you're given a session to help manage your stress.
Yes, one of their members mentioned
Yes.
that would be a good idea.
Yes.
Someone who'd been through been through infertility and been through IVF, and suggested to Discovery that they look at including that in, and they're very open to looking at things like that. So they are going to. They find
That's great.
Dr. Nolly definitely finds mental health very important as well. So this is a very big one, Mans. How can couples communicate effectively about their stress and emotions during the fertility journey?
So I would love to have Louis, who spoke yesterday, come and play his videos, but he will be speaking later. He's an attorney who spoke about, we all think men have the easy part. They give the sperm. But actually, he did a little movie clip of what the men actually talk about and what they go through when they're going through infertility, which we as the women don't see. You need to understand men and women cope very differently with going through fertility. So women are kind of focused on, what is my long-term plan? What am I going to do if this doesn't work? What are we going to do with the next cycle? How do I avoid going to baby showers? How do I avoid going shopping and seeing pregnant women? How do I make sure my husband eats properly, doesn't smoke, doesn't drink? So they try and micromanage this process. Men, on the other hand, are trying to be more optimistic. They're the ones who, there will be a solution. Let's just take this cycle. It's going to work. Let's take it step by step. And often what happens is this independent coping. So I laugh often when I see husbands and they sit there and say, I don't want to listen because yesterday you said something different about how you felt about the journey. And today you're saying something completely different. And next week you're going to be angry about it. But that's the whole journey we go through. And I often say to the men, please just listen. You don't need to fix it. There's this little game I have which is called Snap and Chat. It's photographs of different kind of fertility triggers. So baby shower, pregnant women, healthy eating. And I get the husband and wife just maybe 10 minutes once a week or 10 minutes every night, which is maybe asking a bit much, but to put it down. And when they both relate to a trigger, so if they both relate to the restrictions on their diet, then they can both speak about it. It opens up that conversation where it's not just you independently dealing with how you feel and him independently dealing with how he feels, because he's also feeling scared. So if we can just say, it's okay for the men to express how they're feeling.
Yes.
Doesn't mean this is going to fall apart.
Yes. No, that's very true, man. And you mentioned that Louis played a clip of a documentary. If you guys want to get the information of that documentary, Louis' stand is Kruger Incorporated down there on the right-hand side. He can also give you the clip of the documentary that was focused on men going through infertility. It was very, very interesting. So I know once we've been through infertility and we do fall pregnant, we are stressed about the pregnancy as well, because we're not naive anymore. We know things can go wrong. A lot of us have experienced loss after pregnancy through IVF. And so, like I said, we're not that happy pregnancy. Yay, we're pregnant, it's all going to go great. 9 months went so fast. For us, 9 months go really slowly.
Yeah.
So is there any evidence to suggest that stress reduction during pregnancy can have a positive impact on the health of the baby? Should we worry that we're now stressed about being pregnant? Will it affect the baby?
No, I think the biggest impact will be on you. So when we go through infertility, what does our goal become? But it's that double line and that positive beta and that doubling of the beta. Then it's the heartbeat. It's almost like going through fertility robs you of that naivety or enjoyment of pregnancy. We then start living scan to scan, so you don't allow yourself that enjoyment of that 9 months, whereas the others going blissfully unaware through their pregnancy, which is the majority of people, are looking forward to baby showers and to gender reveals. There's a chapter I've written for a book now for Erica Hoek called Motherhood Resentment. When we go through infertility, we tend to think that when we get our baby and when we're pregnant, we're supposed to be all grateful. We're not allowed to moan. You're not allowed to moan about pregnancy symptoms. You're not allowed to moan like the rest of the population do, which is utterly nonsense. It's rubbish. So these mothers often present with a postnatal depression. Again, not alarming. We can sort that out within 3 or 4 or 5 sessions, but they feel that they're unable to express that this is hard or pregnancy is hard. But it won't, just to all of you, it will not impact on the health of that baby. Maybe your baby will be a little bit more alert and awake, but it's not going to impact as much on the health as it is on your own health.
Yeah, on your own stress. Thank you, Mandy. Please, can you tell us a little bit more about how we find out more about stress management? So I know together with Dr. Rodrigues, you developed a program. Can you tell us a little bit about that?
Yeah, so we developed a stress management program and wrote a book 26 years ago. We've now developed an online stress management course. So for free, you can go and test your stress at www.tups.co, and it gives you 6 different parameters that look at stress. It looks at how depressed you could be, how much your time urgency is, your perfectionism, your anxiety, and then it goes through a very structured self-help program for 10 sessions or 10 workshops in terms of teaching you how to manage it in a systematic, concrete manner.
Perfect. Has anybody got any questions for Mandy that you'd like to ask?
www.tups, T-U-P-S, lowercase, .co.
Anybody else? Any questions? Like I said, she'll be at the MedFame stand for a little while. You're welcome to go and chat to her about anything that you're worried about. Thank you, Mandy, for joining us today again and talking to us about a very important topic. Stress and fertility is very, very important. It affects us all in our day-to-day lives, let alone when we start going through this journey. So I want to say thank you for joining us. And please stick around. Our talks are carrying on, and it's going to be a wonderful day full of information. Thank you.
Thank you.
This is the story of baby Lindy and all the times we've been there for her. We were there in the beginning and when it became official.
Congratulations.
We were there for Mom every day. We were there when big sister-to-be did
There's
this.
like 3 beads. She's been...
It's 2.
It's 2 beads.
When Dad did this.
Cheers, madame.
And when this happened, we were there too. So here we are. Baby Lindy will be born in exactly 10 minutes. Which is why we've organized an ambulance.
Just breathe, Dad.
To help get them to the hospital on time. We were there for baby Lindy. And we will be there for you.
The Infertility Awareness Association of South Africa, or IFASA, is a non-profit organization founded in 2013 as South Africa's first patient advocacy group to educate the public about infertility and to advocate for cover from our medical aids, or South African medical insurance. Infertility falls on the exclusion list of most of our medical aids, alongside cosmetic surgery and acts of war, which means that they don't have to pay for any treatment, even though it's a disease that 1 in 6 suffer from. Our mission as a IFASA is to change that status quo, and we won't give up until there is access to fair cover for all. Infertility in South Africa is different to many other parts of the world, as our country is made up of so many different cultures, and each culture views infertility differently. In the African culture, for instance, a woman's worth is still defined by how many children she can have. Some men insist on their girlfriends having a baby before marriage, just so they can test their fertility. The stigma associated with infertility in the African culture is huge, and the disease remains very misunderstood. And so IFASA continues to fight against the stigma surrounding infertility within all our cultures, in an effort to try and educate everybody that infertility is not a shameful disease, and nor is it a disease that anyone has asked for or brought on themselves, and that people suffering from infertility should be supported and not ostracized. Go to our website, ifasa.co.za, to find out how you can help us to win our fight.